Hi everyone, this is Dhrub. I am one of the cardiovascular imaging fellow in Boston, Massachusetts. So a lot of people reached out to me to get some suggestions or advice during this interview process, because now residency and fellowship interviews are going on. So I thought I would better just share some insights from my experience. Obviously these are my experience, my insights. Feel free to differ. So just for my background, I did quite a few number of interviews during residency, fellowship, followed by advanced imaging fellowship, followed by job. So I do have some suggestion to give you guys in this journey. I know it is very challenging, particularly for an international medical graduate like myself, who are not native speaker. So you have to kind of catch up to that, and this form of interview most of the time new to us, and so we have to kind of learn the process. And I'm very confident that if you follow some basic rules, you'll be fine, and it is very enjoyable journey. Yeah, definitely in first couple of interviews everybody will be nervous, but as you move on to subsequent interviews, you will feel much more confident. So first of all, nowadays it is virtual interview. We used to have in-person interview, which is probably better, but obviously it comes with a cost of traveling, scheduling, all the flight and everything. So there is some pros and cons. We used to get good information about the hospital, about the vibe of the program, location, how people are. But nowadays with virtual it is little different. So obviously there are some pros, as like anything in the world. So when it is virtual interview, it is still important to dress professionally, and not too much but not too little either. Keep it simple. Have like some common shirts, common tie, which you use for all of your interviews. I'm pretty sure we are going to get many interviews, so keep it very simple. Don't try everything, one new thing at a time for each interview, and keep yourself nervous about that. So if you keep everything kind of simple and sort of like repetitive, then probably first interview would be a little bit nervous, but subsequently you will get better. So keep it simple. One of my mentors used to say that keep everything same, so that you will not have any anxiety about preparation for it. Obviously lighting, web camera, this needs to be good. Make sure you have good background lighting, your camera is optimum. Also background, it depends on like how you keep it. If you have really nice background, use it. Blurring sometimes works. At the end of the day, it matters like how you speak with them, how is your interaction, rather than your background. Obviously you should not keep like it messy or anything like that. In that case you can use blurry background if you want, or like some picture, virtual picture, something like that. But make sure those are not the important thing. The main thing is that how you come across as a person, how you talk to them. That is the most important thing. Those things are not going to make any determination of your matching process or anything like that. Then come to the most important question they will ask. Tell me about yourself, or something like that, or what brought you here, those type of thing. Always before answering, always say them thank you, because you are invited there and they are taking time out from their busy schedule for interview. So tell them thank you. Always show gratitude. It goes a long way. Also say like pleasure to meet you, and I'm enjoying since the morning presentations were great, it helped me answer many questions, those type of thing. Then come across as a easygoing person. Remember that they are normal human being. They have probably busy day or boring day, you don't know. So try to make them laugh when you are giving the answer. Try something like that, depending on how the vibe of the program is. If it is very professional, official, then kind of say like normal things, or to talk about yourself, like your journey, your hobbies and all these things. But you can make it a little more interesting. If the person in front of you is more easygoing, then you can say something like that. Do you want to know the funny part of me first, or boring part of me first? Kind of try to make them laugh, and then if you have a kid, then you can tell that your funny part, that you're showing him growing up, and spending time with him during the off time and all these things. Those kind of things, small things in life you can share with them. Definitely it will make more natural, you will feel more comfortable with that person also. So what they try to see in these questions, it is not like to see your CV, not like you will regurgitate your CV or something like that. They're trying to see your emotional quotient. You should come across as a person who is easygoing, who is at the same time has some sense of humor, more like emotional quotient thing. Also at the same time you should come across as like confident, not arrogant but confident, and trustworthy person, because they will have to trust you, your decision making, your personality when treating their patients. So that is important. Also at the same time you should come across as a team player, so that is very important in US. Non-verbal communication is also very important. So how you modulate your voice, how you take pause between your sentences, how you use your eye contact, hand gestures, those are important. So try to stay natural, come across as like you are a person who think and who assertive voice also at the same time, and mature in terms of thought process. So those are the most important thing I would say when you are saying, because it is not what you are saying but how you are saying that is important during the whole interview process. A lot of people will be asked that give me an interesting case, how do you learn something. So before answering to that question, I just wanted to give you some ideas about what I think about these questions and what helped me. Most of the questions they are asking, they are kind of checking your personality and your learning capability from these things and your emotional quotient. So make sure you have certain things in mind in order to answer those questions. It doesn't have to be always very exotic case which you come across and very rare, something like that. Yeah, obviously you can say any rare cases or interesting cases you have seen in your hospital, which would be totally fine. There is no harm in trying with that. But what I have seen over the years, what I got really good feedback that if you tell something which sort of showed your personality, and it does not have to be always like medical, but your personality which kind of showed you how your emotional quotient, how you feel things, how human you are, those are the important thing. So one example I can give you, what I used to tell that during my residency back in India, the most important case I have seen in my life is a homeless person who was sitting outside of the hospital with multiple wounds but could not come to the hospital because he didn't have money. While I was working, I saw that and I helped that person, brought him inside, helped him with the money, and treated him free of cost and helped him in that way. Even though it is not the best case or like most interesting case, but I have learned a wealth of knowledge from that, and the smile at the end of the day I got from that patient, that means a world to me, and it changed my entire perception of being a doctor. So these are the things which kind of showing your human nature, your emotional quotient. You can pick your answers, you can show it, but when you are talking, make sure you have good pauses, you have, so that it conveys your thought process, it conveys your emotion, because a lot of time when you don't speak, that is most important than what you speak. At the end of the day, always say thank you enough, and have your long-term plan. Obviously we are very academic minded individual most of the time. When you are looking for residency or fellowship, make sure you have clear vision of your mind, like going forward in 5 years, 10 years, where you want to see yourself. Obviously you can always highlight your strong points, your family ties to a particular area, and those things are important, and try to highlight those things, but at the same time try to come across as a nice person, because at this point of time your CV, they know everything. You don't have to go into that detail. into your CV, but just like main point should be okay. But they are judging your thought process, how you are as a person, how you are as a human being or as a team player. So those are the most important thing you should convey during this phase. Thank you. Hopefully this video will help you for your interview process, and if you have any further questions, definitely there will be many questions, let me know, I'll try to answer. Thank you so much.